I was driving a car, and despite my son trying to tell me, we're going in the wrong direction, or you're not staying within the lines, I don't hear what he's saying, and I don't realize that I'm doing that. And I'm swerving all over the road, and I'm denying that I'm doing that. Because for what I'm seeing, everything's fine.
She started to pull over, but it wasn't really noticed that she was doing that. And I just yelled, "Stop." And she put her foot on the brake, and we stopped right in front of a pole. And then someone saw us and ran out and called the police and called the ambulance, and they all came out. And instances like that have happened several times.
Diabetes is caused by poor insulin secretion from the pancreas, or the body not using insulin effectively. So that causes your blood glucose levels to rise in your system. And in turn, these higher blood glucose levels cause vascular problems and organ damage, which leads to blindness, limb loss, kidney disease, and heart disease.
To take care of my diabetes, I have to take care of myself. My fitness, exercise, nutrition, eating properly balanced meals, taking my medication, testing my blood sugar.
Diabetes is caused by a variety of factors, including overweight and obesity, as well as poor diet and physical activity. And of course, those two go hand in hand. But there's also strong evidence supporting a genetic basis to diabetes.
Because I've had a couple of really serious incidences, I've taken a lot more responsibility, taking precautions and making sure I don't let myself get to that point. My number one goal is to be preventative.
Research at TGen has the specific goals of predicting who is at greatest risk of developing type 2 diabetes and complications of diabetes, as well as developing better strategies for managing the disease and ultimately preventing disease development in the first place.
If I were nowhere around and she were to be here and to fall into a coma, a diabetic coma, and there's no one here to do anything about it, I don't know what could happen in that situation.
I've been very, very fortunate, but it's nothing to play with. You have to really recognize that any reaction like that could be your last. So it's pretty scary sometimes.
For someone who has diabetes, there is a lot that can be done right here and right now. For someone who's newly diagnosed with diabetes, changing their lifestyle by adopting a healthier diet and increasing their physical activity levels can really go a long way to preventing some of the complications that are usually attributed to diabetes. But in addition, research that's going on in my laboratory is identifying who is more likely to respond to particular drugs that are used in the treatment of diabetes. And by doing so, we can put people on the best treatment strategy for their diabetes. This is called personalized medicine.